The mechanisms of action that we have now for myeloma, we are speaking a lot about immunotherapy, the T-cell engagers and CAR-Ts, but we also have some other interesting mechanisms, novel mechanisms, that are very useful in multiple myeloma. And in fact, we have one of them that is approved. These peptide-drug conjugates. It is, and the response or the main exponent of this type of drugs is Melflufen. It was approved, and in fact, I have to say I'm from Spain, so and it's from the May the 1st we have it available in Spain to be used in our patients. These drugs have a very interesting mechanism that it is Melphalan linked to a radical, which is flufenamide, that is inactive, but when it rapidly enters the tumor cells, and once in the tumor cells it's hydrolyzed and by aminopeptidases that are enriched in cancer cells, so they release the Melphalan, the active Melphalan, and they achieve high concentration of active Melphalan inside the tumor cells. We know that this drug is effective with approximately 30% responses in the initial phase 2 study, and this led to a phase 3, which is the Ocean study. The Ocean study compared Melflufen dexamethasone versus Pomalidomide and dexamethasone. And it was positive in terms of PFS, and particularly, in fact, it was positive in those patients that had not received a prior transplant, or in which the prior transplant had lasted was a good durability of response that was over 3 years. So, and these patients have a great benefit in terms of progression-free survival for Melflufen, 9 months, versus Pomalidomide around 5 months. So it was around 5 months benefit for Melphalan, for Melflufen, which I think it's interesting. The safety profile is very good for Melflufen, mainly with thrombocytopenia, grade 3/4, which is quite high, around 75% of cases, but without bleeding. It was not clinically significant. And otherwise, the tolerability was very good. Patients had a very good safety profile with Melflufen. I think there are some other important points in Melflufen, which is quite convenient because it's given once per month, and this is IV by a peripheral catheter now. It used to be in the central catheter, but now we can use it by a peripheral catheter, and this is quite convenient. As I said, and the good tolerability is also quite interesting for this type of drug. So I think this is good. And the other point is that we can combine that, and I think this is something probably interesting for the future to be used in combination. But this is something we have now, probably positioned after immunotherapy, but this is an interesting drug to have into consideration for our patients.